What am I passionate about in public health? I, I love it all. Every minute, every hour, you're doing something different. So, and you're going from an administrative challenge to a personnel challenge to a public health crisis to any range of things in terms of being able to bring skills of epidemiology, the sciences, social sciences, diplomacy, all of these things that just makes it a tremendous challenge, and the opportunities are huge, particularly with this specialty, because there's so many places you can go. Well, it can be terribly frustrating some days when you look back and you realize how each of these events and activities, because of the investments we made in the understanding of public health and how do you actually apply it, it's kind of like when the stars align, like after SARS, and people sort of finally clued in, but they would not have clued in. We would not have ended up with the agency or the role that I held, or sort of moving ministers and deputies across the country into conversation about public health, which they never had, if we hadn't done that preparatory work. And so sometimes it can be very discouraging, but you just never know. And when the stars align, you have to be prepared for that.
I'm really passionate about making things that are bad, making them better, making things that are wrong, correcting those social injustices. Things are very, very important that we work on in public health. And I think that we are able to make the biggest difference of all health providers. I also realize that it's a way of exerting patience and thoughtfulness and processes, because none of this is going to happen. We can be motivated by 500 years of smallpox before we eradicate it. And so it's really worth the effort because the gains are huge.
What am I passionate about in public health? Well, actually my job. I mean, and that is really fabulous to be passionate about what you do from day to day. My area is hepatitis, but I also do harm reduction. And in harm reduction, I do a lot of work with people who use drugs and trying to make a difference, working with people, realizing that they are the experts in their lives, in what their needs are.
So it was a great opportunity to see, number one, a disease that in this day and age we often, very fortunately, don't get to encounter, and also to follow this very exciting outbreak investigation from the start to the finish and see the other factors that come into play. The media was very interested in this situation, obviously, and it was a great opportunity there as well.
Une investigation d'éclosion de tuberculose dans une communauté, dans une petite communauté. Puis la tuberculose, pour moi, c'est une maladie qui est fascinante parce que, bon, juste d'un point de vue biomédical, c'est une maladie assez complexe, mais c'est beaucoup plus large que ça, tous les aspects sociaux entourant la tuberculose. Une investigation de tuberculose, on ne fait pas ça derrière notre ordinateur en analysant les liens entre les personnes seulement, il faut aller rencontrer les gens.
I enjoy problems. And I enjoy thinking through problems and trying to understand what's really going on, because the types of problems we deal with in public health are the complex, wicked problems. If they were the simple problem, then we would never have to worry about it because someone else would have dealt with it. We deal with the things that have multiple factors involved, a lot of complexity, and the need to talk to people, understand the context, understand the history, try and understand what has worked elsewhere and the evidence to try and find the tailored solution that's going to work.
I always use the analogy of Nancy Drew. If you like to read Nancy Drew, you like to solve things and you like to get to the bottom of them and you like to manage outbreaks and crises and I think all of those things really draw on your own personal resources and what you bring, and the ability to have a much broader impact, I think, is really important. Obviously, who you are and what you bring is important at the one-on-one level or at the family level in a clinical practice, but I think it becomes even more important and your reach and your impact even greater when you're in public health and working at the population level.
So, passions in public health. I think that public health presents a lot of great opportunities to both study and to promote health equity in a variety of contexts.
So the most exciting or sort of inspiring project that I worked on so far as a resident, so I'm a fourth year resident. I worked on a project with Montreal Public Health to try to start their take-home naloxone program, inspired by what's been done in BC and in other jurisdictions around North America. So this is a very concrete, very clearly helpful intervention that saves lives, that empowers people who use drugs with a life-saving skill, and the process of it as well was really just exciting to see. So we were working with everyone from a community-based sort of peer support group of drug users to the Ministry of Health, everyone sitting down at the same table, everyone sharing a common goal.
Je suis aussi fascinée par toute la surveillance de la santé parce que c'est notre outil de diagnostic. Et quand on est capable de savoir où on va, c'est beaucoup plus facile de savoir comment s'y rendre. Quand on sait qu'est-ce qui cause un problème, c'est beaucoup plus facile de voir comment aider aux gens à rester en santé.
To encourage people to ask serious questions, such as, so what? You know, you're collecting these data, you're doing surveillance. What's the point? You know, surveillance is not an end to itself. Just as an example, what are you going to do with it? Are you asking the right question? Are you collecting the right data? How are you going to use it? How are you going to be useful to your public health colleagues? How are you going to be useful to clinician colleagues? How are you going to be useful broadly?
So the most exciting project I worked on as a resident to date was sort of this magical orchestra of tools that I got to use that I had built up very quickly. The learning curve is pretty intense in public health, but it's exciting. And working with epidemiologists and working with nurses and working with people in governmental organizations and non-governmental organizations and people from business and people from physio who are all interested in reducing injury rates in the community across the board. And we wanted to do the best job we could at offering support as a public health unit. I do not like redundancy and I do not like waste. So let's figure out what everyone's doing and let's go in and plug the gap.
But I think probably looking back on it, underlying a lot of what I did was wanting to redress unfairness or inequities and give people the same chance as other people had. And then the other piece that I think drives me is problem solving, looking at complex issues, trying to understand them, using the skills of sort of epidemiological analysis to figure out the who, the what, the where, the why, and the how.
The parts of public health that I'm most passionate about are health equity. I feel that this is really the root cause for a lot of the illness we see today, and I feel that's where we can get the most bang for our buck is if we deal with inequity in our society. Likewise, another area is early childhood development. It's really that first 2,000 days in an individual's life will set the tone for the remainder of their life in regards to health, their position in society, their outcomes. So I think by investing in early childhood development, we could definitely see some significant benefits in society in so many different sectors. So those are sort of my two main passions in public health.
And most doctors serve them in their dire needs of stress and pain and danger. In public health, we try to prevent it, which brings a different type of energy or passion because you don't get the same kind of feedback from the immediate intervention outcome that you do with individuals. So you have to find some passion in preventing bad things from happening, which are very hard to measure. I guess it's probably what everyone says who goes into public health to some degree is, or medicine, is passionate about serving people, whether as individuals one at a time or as part of a population.